How to cope with depression. Feeling sad is normal, but when this sadness becomes so severe that it overwhelms your life, you need to seek help. Learn about the signs and causes of depression and the types of treatment and medication available. Everyone has felt sad at one time or another. Usually it is due to disappointment, frustration, or losing someone. Feeling sad is normal. Time heals, the mood lifts, and people continue to get on with their lives. But for some people, depression can be so severe that it dominates their lives, preventing them from coping as they are used to do. Depression of this degree is an illness or medical condition and requires treatment. So, prevalence of depression depression has been called the common cold of mental health problem. The World Health Organization (WHO) recently ranked depression as the leading cause of morbidity in developing nations in the next century. The lifetime occurrence rate is between 3% to 6%, and it is twice as common in wealth as it is in men. People aged between 20 and 40 years commonly experience depression, although it can occur in children or older people as well. Research has shown that it is even more common in people with a family history of depression. So, what are the symptoms of depression? The following are the most common symptoms of depression. If you experience 5 or more of these symptoms for 2 weeks or longer, you are probably depressed. Number 1, persistent sadness or feeling down or gloomy. Number 2, a loss of interest in activities previously enjoyed, such as socializing with friends and family most of the day, nearly every day. Number 3, loss of appetite and loss of weight. Number 4, insomnia or sleeping more than normal. Number 5, feeling restless and agitated more easily. Number 6, feeling tired and having little energy. Number 7, unable to concentrate and think clearly and thereby becoming indecisive. Number 8, a feeling of worthlessness and guilt. Number 8, recurrent thoughts of death. Now, what are the causes of depression? Some type of depression run in families, hereditary or genetic factors or risk factors. In some families, major depression seems to occur generation after generation. Studies have also suggested some biological components in depression. It may be associated with having too little or too much chemical in the brain. Certain medications have mood-altering properties. Antidepressant medications act by altering and normalizing the biochemical imbalances in the brain. Stressful life events such as loss of job, retirement, divorce, the death of a loved one, or moving to a new house can be a trigger of depression. Social circumstances also play a part. If we are alone, have few or no parents, or suffer from chronic health problems, then we may be more vulnerable to depression. People with a life-threatening or long-term physical illness such as cancer, stroke, or arthritis or heart disease are also more vulnerable to clinical depression. Personality may also play a part in developing depression. Some of us are more vulnerable than others because of the individual makeup or early life experiences. Very often, a combination of genetic, psychological, and environmental factors are involved in the onset of depression. The good news is that whatever the cause or form of depression is treatable. Depression treatments. Depression is highly treatable when clinical depression is recognized and treated. A person's quality of life can be greatly improved. Treatment consists of drug, antidepressant medication, and non-drug therapy. Usually combined treatment is best. Medication to gain relatively quick relief and psychotherapy to learn more effective ways to deal with life stresses. So number 1, antidepressant medication. Medicine is prescribed according to each individual's symptoms, so there is no one size fits all type of antidepressant. Some people with depression respond better to one medication than another. With most of these medicines, improvement is not immediate. It takes 1 of 3 weeks before changes occur. Some symptoms diminish early in treatment, others diminish later. Energy levels or sleeping and eating patterns, for example, may improve before the depressed mood lifts. Medication should be taken for 6 to 12 months or longer as instructed to allow the medication time to work. For those who have had several bouts of depression, long-term treatment with medication is the most effective means of preventing more episodes. While all antidepressant medications are equally effective, they have different side effects. The most often used antidepressants to treat depression include tricyclics, monoamine oxidase inhibitors, lithium and selective serotonin inhibitors (SSRI). Be patient when you take the medication. Antidepressant medication do not begin working the day you take them, but your mood will improve after 1 to 2 weeks. You may notice some improvements on the first day, especially in your sleep, and you feel less tense and anxious. Such antidepressant medications are not addictive. You can eat a normal diet. If not, your doctor will tell you the medications are compatible with painkillers, antibiotics and contraceptives. However, you should avoid alcohol as medication, and alcohol combined can make you too drowsy. Do not stop the medications once you start to feel bitter, as you may relapse into depression again. You should discuss this with your doctor and let him advise you when to stop. Like all medications, antidepressants have some side effects. So these are usually mild and tend to wear off as treatment goes on. Some side effects of antidepressant medication: dry mouth, constipation, dizziness, drowsiness, nausea and stomach discomfort. Number 2, non-drug therapy for depression. Psychotherapy. Psychotherapy can be defined as a psychological treatment through the establishment of a relationship between the therapist and patient to relieve symptoms and correct unhealthy patterns of behavior. The key is in managing relationship, and this requires training and experience. The depressed person receives therapy through talking with a therapist as opposed to relying solely on medication to treat depression. A trained and experienced therapist can provide a safe platform for a depressed person to work through his issues through formal psychotherapy. There is a variety of psychotherapies which can be tailored to the individual's need. To make an appointment to see a doctor, please call to the prescribed number. Exercise. Exercise not only improves your health but also gives you a sense of accomplishment. Endorphins, feel-good hormones are released during exercise, and this can elevate your mood. Relaxation therapy. This involves deep breathing exercise and progressive muscle relaxation. Support groups offer fellowship, and you get to hear first-hand accounts of how others with descriptions and depression have learned to cope. Presently, the Singapore Association for Mental Health (SMH), Institute of Mental Health (IMH), and the Behavioral Medicine Clinic at IMH run support groups. The groups at IMH is a psychoeducation group. You learn about the depressive illness and methods of coping. So if you like the video, please subscribe our channel, and for more videos please also press the bell icon, and thanks for watching.